Good afternoon, good evening, everyone. Welcome to another episode of awareness on various conditions around, especially chronic conditions. I'll do a quick introduction before I introduce our panelist, Dr. Somnath Chattopadhyay as well. Just do a quick share. Yeah, so today's topic is liver diseases and complications during COVID-19. And this is a very important topic for patients with liver diseases. Um, Quick introduction on Patients Engage. We are an online platform operational for over 5 years. We focus on evidence-based management of chronic conditions from the perspective of patients and family caregivers, and very strongly believe in the value of lived experiences and how being informed and being engaged with your own health leads to better quality of outcomes and better quality of life. We've been doing webinars for a long time, but in the last 4 months, we've really seen a lot of improvement, just as everybody has. But we've used the platform to inform and engage patients and address their questions during these times. Today, we are very pleased to have with us Dr. Somnath Chattopadhyay, who's a consultant and head of department, Hepato-Pancreato-Biliary surgery and liver transplantation at Kokilaben, Dhirubhai Ambani Hospital. And he will talk to you about liver diseases and complications during COVID-19. Quick reminder to all our attendees, this is not a replacement for your personal consultations. This session will be recorded, and if you're logged into Zoom, you can type your questions in the Q&A box. If you are on Facebook, you can post them on the live feed and we will pick them up from there. And as always, if you have an experience, you can write to us at editor@patientsengage.com, and you can follow us on our website. You can download our ebooks and the various social media handles, Facebook, Twitter, Instagram, and these recordings of these videos also go on our YouTube channel. So over to you, Doctor.
Yeah, thank you so much for this. I think it's important that we keep on doing this in these times, especially because now going to the hospital is always you have to be careful, and only when you really need to go, you should go to a hospital. I'm going to talk about liver cirrhosis. It'll be mainly in the form of question and answers, and I'd like to I'll encourage the participants to ask questions so that we can make it more interesting. To begin with, I'll give a short a PowerPoint presentation, which basically will tell you about what is liver cirrhosis and what is transplant. And then we can go on to the quick Q&As, and especially in this era of COVID, how to take care and any kind of questions regarding cirrhosis and COVID-19. So what is end-stage liver disease? So liver cirrhosis, the commonly used word that we mostly use in medical terminology is liver cirrhosis. The other term, when you start getting complications due to liver cirrhosis, we call it something like, the term that is used in medical parlance is end-stage liver disease. So what is end-stage liver disease? It's usually a characteristic of when you start developing complications of liver cirrhosis. That is called the end-stage liver disease. So mainly, can we go to the next slide? So I'll talk about the main symptoms that we see when we call someone that, when we tell someone that you have complicated liver cirrhosis or complications of liver cirrhosis or end-stage liver disease. The most common symptom that is the most well-known also when we talk about liver disease is jaundice. So any episode of jaundice in someone who has a cirrhosis of liver diagnosed on an ultrasound or low platelet count or any other medical test, simple test, will be one of the complications of one of the stigmata of end-stage liver disease. Unfortunately, there is no treatment for jaundice. Sometimes if the jaundice is due to some infection or a viral hepatitis, the body takes care of itself and the jaundice gets better with the treatment of the complication. But there is no medicine with us to cure the jaundice as such. Now the next condition is ascites. So when ascites is when you start developing fluid in your stomach. Patients with liver cirrhosis who have undergone this will understand that once you start getting ascites, usually the doctors will prescribe you something which is known as diuretics. Basically, these are medicines which will increase your urine flow. And with the increase in urine flow, we hope to reduce the fluid or the water that is accumulating inside your abdomen. If these medicines are not enough, then we go in for tapping of the ascites, which is known as large volume paracentesis or LVP. So in this, what we do is an ultrasound guided. We put in a needle inside the belly and we take out the fluid. More often, this is usually given along with albumin, and sometimes we have to repeat it frequently in a month or even in 2 weeks or so. The problem with diuretics is sometimes, or the water pills, is that sometimes it may lead to kidney damage, which is again a serious complication. The third cardinal sign of end stage liver disease is spontaneous bacterial peritonitis. This is basically an infection in the fluid that is getting accumulated in the belly. It is usually treated with IV antibiotics and albumin. Next slide. Then the other symptom, which is again quite dramatic, and so that's how many times patients are diagnosed for the first time with liver cirrhosis, is upper or lower GI bleed. That means either blood in your vomitus or blood in your stools. So usually when you experience something like this, if it is in a small amount, then you undergo a routine endoscopy with control of the bleeder. Sometimes it may be a massive bleed where you have to go to a hospital, get admitted in the ICU, and then you need an emergency endoscopy, and then you have to control it. Sometimes the veins in your stomach also gets engorged or get swollen up, and in that ways, it's very difficult to control with endoscopy. And these patients, they usually need something more than an endoscopy. There's also a procedure which is known as TIPS, which basically bypasses the liver and tries to reduce the portal pressure. The risk of TIPS include encephalopathy, which I'll talk about in the next point, and also liver failure. So you have to be very careful and consult a hepatologist or a liver transplant surgeon before going in for a TIPS. The next stigmata, which is also very important, is something known as hepatic encephalopathy. This symptoms arises when the liver becomes damaged, and it's the one of the main jobs of the liver is to clear the toxins which are circulating in the blood. So when the liver gets damaged and the liver is no longer effectively able to do this job, the toxins, they get accumulated in the brain and cause something known as encephalopathy, which may be as mild as uh, you know uh, improper sleep, to as grave, to confusion, loss of memory, to as grave as going into a coma. And the treatments are, you have to rule out infections or bleed. Sometimes we prescribe laxatives to increase the stool, so that sometimes the ammonia and the toxins, they pass through the stool, and drugs like rifaximin. Next slide, please. And the last and the most grave complication of end-stage liver disease is when it starts affecting the kidney, where we call it hepatorenal syndrome. Basically, your kidneys are otherwise okay, but there is nothing wrong with your kidneys. But because the liver is not working well, it starts affecting your kidney, and you start having an increase in your serum creatinine level. Sometimes we can control it with medicines like albumin, terlipressin. We have to rule out whether there's something wrong, actually, any kidney disease also. And this symptoms, when your creatinine starts going, it becomes imperative that you go to a transplant center and start thinking about a transplant, because this condition has a very high risk of mortality if we don't manage it in the right time. Next slide. So just to give you an idea, when talking about end-stage renal disease, end-stage liver disease complications, so if you just have presence of cirrhosis on an ultrasound and otherwise there are no symptoms, the median survival is as good as 9 to 10 years, maybe even more. And you don't need to worry about a liver transplant. You should just keep on doing your tests so that you don't miss out on anything. Once you start getting decompensated cirrhosis or complications of cirrhosis, as we talked about, the survival goes down rapidly to 1.6 years. If you develop an infection in the fluid in your belly, the survival goes down further to 9 months. And if your kidneys start getting affected, the survival can be, depending on how fast the kidney is getting damaged, it can be 6 months to 2 weeks. So this is to give you a timeline of what what and how urgently it's required that you go and seek proper help. Next slide. So there are various causes of liver cirrhosis, and sometimes patients ask that, I don't even drink, and so why did I get liver cirrhosis? So alcohol or ethanol is only a small portion of it. I mean, and this is worldwide data. So as I was talking about, so the black part of the pie chart, if you can see it, this is the liver disease due to non-alcoholic steatohepatitis or non-alcoholic fatty liver disease, which I'll talk about maybe in detail later. This is around 20% of the liver cirrhosis happens when the patient doesn't have any history of alcohol intake. And then there are other causes like hepatitis C, hepatitis B, liver cancers, liver failure, and then other causes in pediatrics and autoimmune diseases. So alcohol is not the only reason why you can have liver cirrhosis, and diabetes, which can lead to NASH, is also a major cause. Next slide. So the curative treatment, the only way to cure end-stage liver disease is a liver transplant. All this treatment that I was discussing in the past few slides, they were all trying to keep the complications under control. So none of these were something which could reverse the cirrhosis. So we don't have medicines to reverse cirrhosis, and the only treatment is when we change the liver, which we call as a liver transplant. Next slide. So who needs a liver transplant? Anyone who has reached the end stage of liver disease or decompensated liver disease. When you start developing jaundice, you start developing fluid in your belly, you can have an infection in that fluid, you can have encephalopathy, that means you start getting confused, you lose your sleep, you can have a bleeding either in the stools or in the vomiting, and you can have jaundice. So these are the people who should start thinking about a transplant, and a timely transplant will cure the whole problem and solve it once and for all. The next cause of who needs a liver transplant is someone who has acute liver failure. These are patients who do not have liver cirrhosis, but due to some reason, either a viral hepatitis or medicines like anti-TB drugs or Ayurvedic medicines, they can have something which is known as an acute liver failure, where the liver fails within a very short period of time, and these patients can be cured with a liver transplant. And the third is patients with liver cancer. If they can come on time, we can cure the liver cancer by doing a liver transplant. Next slide, please. Transplants are of two types. One is a cadaveric liver transplants, where organs are donated after birth, after death. The organs are pledged before death. The family or the patient decides that they want to donate their organs, and organ donation day is coming next month. So it's an important way in which we can help liver cirrhotic patients, and the family has to agree for donation. And the next step is a living donor liver transplant, where a portion of the liver from a family member is taken and then placed, and by a surgery it's placed into the recipient. The good thing about liver is that liver can regenerate. So if you divide the liver, it grows back, and the growth takes place rapidly. In about 6 weeks, you can get the entire size of the liver can grow back. So this is a very safe surgery for the donors. And these are the two main types of transplants. Next slide, please. So there are a few differences between the cadaveric and living donor transplant. Now, these are very important when you consider which kind of transplants do you need. Cadaveric transplant in most centers in India, the waiting time is between 3 to 6 months. For living donor, there is no waiting time. As soon as the donor is ready and you have the correct permissions, you can go and do a transplant. Now, this 3 to 6 months is is different in different parts of the country. Some places like Mumbai, it'll be around 3 to 4 months, maybe more if it's a common blood group. Some places in the north of India, they will have a longer waiting time. But the cadaver transplant is an emergency, so you need to be able to reach your hospital in about 4 to 6 hours. So places which are very well connected, patients then can go back and stay in their places. If they are not very well connected, then they may have to stay in Mumbai for some time before they can get an organ. Living donors is not an emergency. It's a completely planned procedure. You select the day, you select the time, and you do the procedure. The organ quality in cadaveric transplants are usually unpredictable because although they are of good quality, but because patients who are donating their organs at the time of death are usually elderly and usually have diabetes or any heart problem. In living donors, the organ quality is excellent. Cadaveric transplants are preferred for patients who are either very obese and there is no suitable donor in the family, or a living donor is not available. And living donors are preferred for patients with acute liver failure, patients with liver cancer or HCC, and patients who are very sick and who cannot wait for 3 to 6 months. For cadaveric transplants, the donor risk is not relevant. For living donor transplant, there is a 0.2 to 0.5% donor risk, which is very minimal, but the family or the donor has to accept because it's a voluntary procedure which the donor doesn't need, and the donor is giving it for their own loved ones. That's the end of my PPT, and then we can go on to the next.
Yeah, so I'll start with some of the questions and then we'll take the questions as they come in as well. Does diabetes and obesity cause liver cirrhosis and liver cancer?
Yeah, so I think this is a important point that as I was talking about NASH, since India is endemic and it's also called the diabetes capital, we see that a lot of our patients, they come with diabetes and obesity and hyperlipidemia, and that's going to be probably the estimation is in the next decade, probably 50%, 40 to 50% of the transplants around the world will be because of NASH, which is due to diabetes. So in fact, we recommend that patients who have long-term diabetes should start getting yearly ultrasounds to check. And the other thing which is important is diabetes and NASH. Once you develop NASH, you can develop a liver cancer even if you don't have cirrhosis. So this is something you have to take care. And a yearly screening is absolutely essential for these patients if you have long-term diabetes and
Right,
obesity.
right. And is NASH curable apart from a transplant? That's a question
So
we've got.
once you start developing complications of NASH, that is complications of cirrhosis, then you need a transplant and that'll be curable. We are not going to treat the diabetes though, or
Right,
the obesity. That will still take medicines and you can do exercises, but at least the liver failure and the liver cancer, that will be treated.
right. Okay. And doctor, you talked about how soon the liver grows back in the donor, but how soon does it grow in the transplant recipient?
Oh, it's actually very interesting that the liver grows back even faster in a recipient. It's like the liver is like a engine of your body. So if you need more, the body somehow nature works that way that if you need it more desperately, it grows faster. So in
Right.
a recipient, it grows in about 4 weeks.
Wow. Okay. And also in the current scenario, have liver transplants resumed? And if they are delayed, how can those who are on the waiting list manage?
So again, I'm very important. There's been a lot of panic, understandable around the COVID pandemic, but most of the countries around the world which have suffered hugely through corona, like the US, Italy, Spain, nobody stopped doing transplants because transplants, along with cancer surgeries, are classified as emergency surgeries. And
Hmm.
we all know that once you start getting complications, I told you the kind of survival that patients have. So transplants have not stopped due to this the COVID pandemic. We were very careful, and we did, patients who require it very. We took all the precautions, and it did slow down because the organ donation rates went down. So,
Correct.
but it didn't stop, and it should not stop, because once you start developing complications, the chances of you getting into trouble with the complications is much more than corona infection.
Right, right. One question that's come in, if patient is having low albumin and high globulin levels, is it serious and what are the treatment options?
So again, it's serious because it indicates that your liver is not making albumin is formed by the liver. So if the liver is damaged due to some reason, the albumin level will come down. It's a sign for us to look at. That the liver is not working very well. It's also an indicator that your nutrition is not good, and your muscle mass is not good. So it's an important thing to look at when we talk about. Unfortunately, there is no quick fix to this. You can if you improve your diet, increase your protein intake, do exercises, you may be able to increase your albumin level a bit. Giving IV albumin is not the answer to that. Sometimes we do need to give it for acute reasons, but this is not a quick fix. If the albumin is very low and the liver is cirrhotic, we would advise a transplant.
Okay. And for transplant recipients, can they, if they're women, can they become pregnant and bear children? And you clearly say that exercise is important, so I presume they can play sports and stuff like that as
Yeah,
well.
they can go back to their normal lives. So 60% of females of the childbearing age, they can get pregnant. It's a high risk. It's classified as a high risk pregnancy because you need to be under a care of a gynecologist from the beginning, and you need to involve your transplant physician also, because we need to make some changes. But pregnancy is very successful, and we've had many patients who have had successful pregnancies. You just have to be careful and take the medications on time, check your blood pressure. There's a risk that your blood pressure may go up.
Right.
And we usually advise that after the transplant for 1 to 2 years, till your transplant is completely settled, we advise them not to conceive. And after that, it's very safe.
Right, right. Are there any other, you know, aspects you'd like to talk about in terms of life after liver transplant?
So the main thing, that the myth that goes on, is that transplant patients, they are on a very restrictive kind of a bound kind of a life. They have to live in a very careful manner. You do have to be careful. You have to have a lot of common sense and use your logic. But other than that, you can do you can lead a normal life. That's the point of doing this operation, because we want you to go back to your lives. And this is not a liver cirrhosis is not a cancer. So you can get a very meaningful long life after a liver transplant. uh, your entire natural life, if the liver works, if you take proper precautions. So you can go back to your office, you can work, you can go for movies, go to a gym, work out, everything that you would do in your before you had this problem, you can go back to doing that.
Right. Couple of quick questions. So one is, what is the probability of liver damage in hepatitis B cases? And yeah, okay, let's do that one.
So hepatitis B usually comes as an acute phase. Like you can usually present with jaundice, and most of the times, almost 80% of the times, the body will clear the virus uh, on its own, and you will not have any other problems.
Hmm.
Only about 20% of the times you can develop something known as a chronic hepatitis B, where the virus stays in your body for a long time. But even in these patients, you don't need treatment for all patients, and you can live your normal life. In a very small percentage of these patients, probably about 5% or 5 to 10% of them, they
Hmm.
can go on to develop liver cirrhosis and liver cancer.
Right. Many young people nowadays are not found to have fatty liver. Sometimes it's an accidental diagnosis. So what's your advice for them and how can they manage?
So fatty liver is a lifestyle problem. Uh, the management, there are no medicines which are needed. The only thing that we prescribe for these patients are to go on a diet and start doing regular exercises, and that usually works very well for these patients.
Okay,
And that's what we prescribe.
okay. Any regular tests to be done to monitor NASH?
So patients who have long-term diabetes should include, I would say, a 6 monthly liver function test. And if there are any abnormalities in that, they should go and get a physician checkup, and they should at least do a yearly ultrasound
Right.
to look at if the cirrhosis is developing or not.
Right. Somebody is asking, can I read the question in Hindi?
Yeah, sure.
मेरा 10 महीने पहले लिवर ट्रांसप्लांट हुआ था, हेपेटाइटिस बी पॉजिटिव हूँ, आगे के लाइफ के लिए मुझे क्या प्रिकॉशंस लेना चाहिए?
एक तो आपको अपने हेपेटाइटिस बी की दवाई जो है वो कभी बंद नहीं कर सकते हैं आप। वो दवाई जो है वो वायरस को हमेशा कंट्रोल में रखेगा। और उसके अलावा जो नॉर्मल प्रिकॉशंस जो आप ले रहे हैं ट्रांसप्लांट की दवाइयाँ वो बंद ना करें। और जो कॉमन सेंस जैसे हैं, जैसे साफ पानी आप जो पिए वो साफ होना चाहिए, खाना जो आप खाएं वो हाइजीनिक या साफ सुथरा होना चाहिए। और बीमार लोगों से आपको, जो अगर कोई बीमार आपके सामने कोई आता है किसी, तो वो आपको दूर रहना है। इन सब प्रिकॉशंस के अलावा और कोई अलग से प्रिकॉशन नहीं है। ट्रांसप्लांट की दवाइयाँ और हेपेटाइटिस की बी की दवाइयाँ कभी बंद ना करें।
Okay. And question again, you said that post liver transplant one can lead a normal life. Is the diet restricted?
There is no restriction on the diet. Obviously, you need to, if you have NASH and you've had a transplant because of NASH, then the obesity is something which you will fight again after that. So once your liver is good, you have the energy, I think you should go back to doing some kind of exercises so that you can keep your cholesterol, your weight under control, you can keep your heart condition in a proper way. So in that sense, the diet is restricted. From the liver sense of, from the liver side, there is no restriction. You can, you can have a normal diet which is healthy and hygienic.
Right. Okay, one question. After a kidney transplant, does the liver get affected due to medicines after kidney transplant?
No, not very common. Very rare.
Okay. Question, is GGT level elevated in fatty liver?
GGT is more of an indication in alcoholic liver disease. It can go up in some kind of a liver damage. It's not. It's just a part of the liver function test. So as a single value, GGT doesn't have any value. So I would not recommend that you look at your GGT and get worried. If your liver function test is abnormal, I would advise that you go and see a liver physician.
Right. Okay. So coming to specifically around COVID, are transplant recipients at greater risk, liver transplant recipients at greater risk of COVID infection? And also, are people with liver diseases at higher risk?
So the first part I'll address first.
Right.
So as I said, countries like the United States, even when they were in the middle of the pandemic, Italy, Spain, they continue to do transplants. So we have a lot of data about this, and surprisingly, the transplant patients didn't do that, didn't have a worst outcome after COVID, and there was not an increased incidence of COVID in transplant recipients as such. Something maybe, I mean, we don't know exactly why, but we know that transplant patients are on steroids, which is one of the treatment for COVID. So if you take proper precautions, and if the transplant is, you take all the regular isolation and precautions, transplant recipients, they do as well as any other population. Now coming to liver disease, liver cirrhotic patients, we have enough evidence that liver cirrhotics, if they get a COVID infection, they don't do well. So that was exactly what I was talking about earlier, that if you have liver disease, your immunity is low, and you are prone to develop infections. In that case, you don't have the strength to, there's a risk that if you get an infection, it's a serious problem for those patients. For organ transplant recipients, the liver is working well, but you are on immunosuppression, so you have to be careful. But we haven't seen that organ transplant recipients are, at least in these countries from the data, that they're doing very badly.
Okay. One question on Facebook, is stage 2 fatty liver reversible? And is that only through lifestyle modification? or are there any medications? I know you
Yeah.
said
So
fatty liver is,
yeah.
yeah.
So stage two liver fatty liver is reversible, and you can have some medications like vitamin E, which can help again for a short period of time. But again, the main thing that helps is losing your body weight, and which is due to through diet or exercises.
Right. Um, so what are the precautions that liver transplant patients should be following during these current times?
So basically, transplant patients already follow, the precautions that are right now important for the COVID pandemic. The
Mm,
transplant patients are already, as I told you, we advise them to have food which is very hygienic, preferably prepared at home, water which is clean, and stay away from, people who are not well. So basically, this is the extension of what we are prescribing to general population also. So at this time, they have to be very careful that if you have to go outside, only if it is necessary and you're a part of an essential workforce, you should go out. Uh, Always wear a mask that is really protective. That no point of time you should be without a mask. There are no side effects of a mask, and you should not touch your mask ever, and try to restrict in these, for instance, the the till the peak is gone. I mean, try to not go out and only probably go out for essential services. That should be it, and don't ignore any of the signs. If you have any fever, then talk to your physician. We can get the test done very easily, and take care of it.
right. Um, if a family member gets infected, what should be the precautions?
If a family member gets infected, transplant recipients are, according to our ICMR guidelines, they are at a higher risk. So I would not advise home quarantine for transplant patients. I would advise them to contact in Mumbai BMC, and preferably inform that you are an organ transplant recipient. And I'm sure that they would advise you to go to a hospital and get admitted there. So home
So the
quarantine.
family member will get the infected family member will get admitted, or the transplant recipient will be
No,
admitted.
if the transplant recipient is COVID positive, then I would not advise home quarantine.
Correct.
I
Right.
would advise that if the transplant recipient, and if you are staying in the same house with someone who's infected, then preferably not go for home quarantine, and that relative also should probably go for a outside quarantine center instead of
Right.
putting
Right.
anyone at risk.
Okay. Okay. And since you brought up if a transplant recipient gets COVID, so you said that they should not isolate at home. They should.
They should come on time and not get panicked, because right now we have very effective medications, and which can, if on time, you can come with convalescent plasma, the remdesivir, all the medicines that we have. If you can come on time, there's no reason why you should not do well, very well.
Right. A couple of other questions. Can you explain the connection between portal hypertension and cirrhosis? And a second question with the same person, long-term side effects of immunosuppressants.
Okay. So portal hypertension is when your liver is basically a filter of your body's blood, of your abdomen's, the blood. So when the liver gets hard or cirrhotic or scarred, the blood pressure in the portal pressure, which is the main vein through which the blood flows through the liver, goes up. It's like a pipe which gets choked, so the pressure in the pipe goes up, and then it leads to various problems like bleeding through the veins, ascites, or fluid getting accumulated. Um, so portal hypertension and cirrhosis are correlated. If you have advanced cirrhosis, then you will have portal hypertension. And
Right.
the next question was,
Long-term side effects of immunosuppressants.
so mainly the side effects of immunosuppression are on kidney, so you have to be very careful on that. Some patients may develop diabetes, about 20% of them. Some patients may develop something which is known as metabolic syndrome, which is similar to NASH. That is, you can have diabetes, hyperlipidemia, or increase in your lipid cholesterol levels. So these are the main. Some patients may also develop cancers. So there are some long-term side effects, but in India, we mainly, I would say, effect on your kidney and development of metabolic syndrome.
Right, right. Um, okay, I think we are pretty much to the end of our questions. We've got one final questions. I'll also, kind of ask people to fill out the uh, feedback as well. Um, so while I ask the last question, yeah. One final question. I think the concern that people have is when we do get a COVID-19 vaccine, will transplant patients be able to take the COVID-19 vaccine?
Yeah, I think everyone is now thinking about the COVID-19 vaccine. So I hopefully we'll start getting many vaccines by the early next year or so. So transplant patients cannot take any kind of a live vaccine. So if the vaccine, there are various ways in which vaccines are made. They can be made by using, making the virus weak, and then trying to get immunity through that. It can be made through various components of the virus, which can then lead to immunity. So transplant patients cannot. We don't know for sure how it works, but like every other vaccine, transplant patients should not be taking live vaccines, live attenuated vaccines. So I think they will have to wait for something like an mRNA vaccine or vaccine which is only on a particular component of it, not the live attenuated one. So they may
Okay.
have to wait a little bit longer.
Okay. I think that's an extremely important point that often we don't understand. So thank you, doctor. I think, and thank you to all the attendees. Looks like we have one more question that's come in because of the vaccine question. Can transplant patients take the annual flu vaccine?
Yes, they can and they should actually, because these are not live. They don't have any active virus in that.
Right.
They
So both the flu and the pneumococcal, right?
Yes.
Right. Okay. So yeah, thank you, doctor, for taking the time to answer all these questions. I think it's been an extremely informative session, and I'd also like to thank Biocon for facilitating this. And I think we had very good questions as well from the audience. So really appreciate everyone's time on this. And as I said, we will put this up on in a few days up on our YouTube channel as well. So, and all the people who are attending, please do share it, because it's these topics are often not talked about, especially to patients. So I think it's important that we let people know. And I think this was really one of the most useful sessions we've done. Thank you, doctor, for taking the time in your busy schedule to answer all our questions. And I think the doctor has lost his connection. So yeah, so thank you everyone, and thank you to all the attendees as well. Let me stop the live stream.